Today I'm going to demonstrate how to perform a wet to moist dressing change. Before you go into your patient's room, you want to make sure that you check your doctor's order to anticipate all the supplies that you're going to need and gather your supplies. When you go into the room, you're going to knock on your patient's door, wash your hands. Hi, Mr. Steeler. I'm Jody. I'm going to be your nurse today. How are you feeling?
I'm okay.
At this point, you want to ask their name and date of birth. Can you tell me your name and birthday?
It's Ben Steeler, July 5th, 1971.
Good. And are you in any pain?
No.
If your patient were having pain, you could take this opportunity to medicate them before you did their dressing change. Now I'm going to clean my table off so that I have a clean workspace, and I'm going to grab my supplies. Okay, so the supplies that I need to perform this dressing change are a dressing change tray. It tells you everything that's in here, so make sure that you look at your contents. I need Kerlix. I have an extra ABD pad, gauze. I have a garbage bag, pen and tape, saline, and measuring devices. So I have cotton tip applicators and a measuring tape, and I have sterile gloves. I always keep an extra pair of sterile gloves in my pocket in case I need to change them. At this point, you want to make sure that your table is at least waist height, and you want to raise your patient to a comfortable level for you. We're going to remove our old dressing, so I want to make sure that I have clean gloves on to remove the old dressing. I always put my side rail down too so that it doesn't get in the way. I'm going to apply my gloves. And you want to expose only the wound area, so keep the patient as covered as you can get them. All right, Mr. Steeler, I'm just going to look at your dressing here. And I'm going to put my garbage bag nearby so that I can dispose of my old dressing. So we're going to remove each layer. You want to pull the tape in towards the wound. And we're going to examine each layer. So when we're looking, we're going to look for code, color, odor, drainage, and we're going to look for edema and erythema around the site. Dispose of each layer. When you get to the Kerlix packing, you have to kind of judge to see how much you're going to need to cut for when you're dressing your wound. And then we're going to take off these gloves. We're going to wash our hands and put new gloves on so that we can measure our wound. When we measure the wound, we want to measure length, width, and depth in centimeters. So I'm going to take my measuring tape. I want to be sure not to touch the wound bed and just hover above. So our wound is about 15 centimeters, and the width is going to be the widest part of the wound, which is 3.5 centimeters. I'm going to discard of that measuring tape. To do depth, I'm going to use a cotton tip applicator in the deepest part of the wound, slide my fingers down, and then measure in centimeters, and that is 2.5 centimeters. I'm going to get rid of all of my supplies, take off my gloves, and wash my hands again. Now I'm going to set up my sterile field. I make sure to take everything off of my table that I don't need and put it to the side. So we're going to take our dressing change tray and we're going to open it away from us. In here you see that there's a blue side of this drape that says sterile field, pick up here. You're going to pick straight up and make sure that you don't drop below your waist. You want the blue side to be facing towards you, and then you're going to drape it over your table, making sure that you're not covering anything with your drape. Now remember, we have a 1-inch border all the way around that's considered non-sterile. Anything below our 1-inch border and below our waist is considered contaminated. Now we're going to load our field. So we're going to take the contents of our tray and drop on our field. This container is going to become our basin for our saline, so we want to make sure that we maintain sterility of that. Going to load our Kerlix. extra abdominal pad. And gauze. Okay, so I want to take a time out and make sure that I have all the supplies that I need. Once I see that I have all my supplies on my field, I'm going to open my saline. If this were a new bottle, I would just open and write my date, time, and initials on it. It's good for 24 hours. If this were a used bottle, when I open it, I'm going to check to make sure that it's still within the 24 hours, and I'm going to palm the label so that no fluid covers my label, and I'm going to lip into the garbage can. I'm going to pour my saline and then set it aside. Now I'm ready to put my sterile gloves on. I move everything over so that I have good working area for my gloves. Okay. Remember, I cannot turn my back to my sterile field. Now, since this isn't in my working area, I can leave this here, or you can pick up from the center if you're going to discard of it, and if you're going to drop it in the trash can, make sure you keep your hand above waist level when you drop it. So now I'm ready to prepare my field. I'm going to organize my supplies. Make sure that you're not reaching over your field. In order to clean our wound, we're going to make a pledget out of 4x4 gauze. So we're going to take 4 corners and put them up together so that we have something to hold on to. Some people call this a parachute. So with your parachute, you're going to dip in your saline, you're going to wring it out, you're going to clean from one edge of the wound from top to bottom, and you're going to throw that away. You're going to get another pledget. Dip in your saline, clean top to bottom, and throw away. Now I'm going to cut my Kerlix for my wound. Okay, and when I have my Kerlix, I'm going to fluff it. So I'm going to take this first layer and separate it. Like that. And then I'm going to moisten it in my saline. I want to make sure that I wring this out. I don't want to put this sopping wet into my wound. I'm going to position this in my hand so that it's easy when I'm packing my wound, and I'm going to grab my tweezers. So you want to start at one end of the wound and go back. You want to make sure that you fill the wound bed with your Kerlix, making sure not to touch the outside skin. And then I'm going to discard of these because they came in contact with my wound bed. Next, we're going to top this with moistened 4x4 gauze. So we're going to take our gauze, saline, wring it out, and then I do half folded over. You want to make sure that a lot of this isn't sitting on the outside skin area. Okay, now that I have this part done, my last step is to cover it, and we're going to use an abdominal pad to cover. You may also hear it be called an ABD. This is our ABD. The blue line goes up to the sky, and you're gonna go over your wound to cover the area. Now our sterile part is over and we're gonna cover with tape. Your kit comes with tape, or you can also bring extra tape into the room with you. I'm gonna grab my tape and I'm gonna tape like a window around my wound. Then I'm going to take my gloves off and wash my hands, and I need to put my date, time, and initials on a piece of tape and onto my patient. Okay. And then my last step is going to be to document my findings. So what I seen when I looked at the wound, what the drainage was, how my patient tolerated the procedure. I'm gonna cover my patient back up, ask him how he's doing. How are you doing, Mr. Steeler? You did great.
I'm fine.
I'm going to get rid of all of my garbage, lower my patient back down, make sure they have their call light in reach.